If you've ever felt that sharp, nagging pain right at the base of your spine, you know exactly what I'm talking about. It can turn something as simple as sitting down into an act you start to dread. So today, we're going to talk about that, not just as a problem, but really as a path toward understanding and, more importantly, relief. You know, this description of chronic pain, it just hits the nail on the head, doesn't it? An alarm bell that's just stuck on. It's not just a little discomfort, it's this constant loud signal your body is sending. And realizing that signal is real, that's always step one. Okay, so let's get into it. We're gonna unpack what this tailbone pain or coccydynia actually is, and then we're gonna look at the very hopeful, very real paths that can lead you toward feeling so much better. At its heart, coccydynia is pain that gets triggered by pressure. Simple as that. But that simple fact means sitting at your desk for work, driving your car, even something as enjoyable as riding a bike, it all becomes incredibly painful. It changes how you move through your day, doesn't it? Which brings us to a really important point, understanding why. Why is this happening? Let's take a minute to really understand your tailbone story, because once you know the why, you're so much more empowered to find the right solution. So the medical term is coccydynia. It sounds a little complicated, but all it really means is pain in your coccyx, your tailbone. It's that tiny little segment at the very, very end of your spine. And the pain itself can feel so different for people, from a sudden sharp jolt to this deep, persistent ache. So where does it even come from? Well, sometimes it's from something really obvious, like a fall, but it can also develop from the incredible strain of childbirth, or even from smaller repetitive things like cycling or just sitting for a long time on a hard chair. It's also really important to know it's about 5 times more common in women, and having a higher BMI can also be a factor. This really gets to the heart of it. The best treatment plan, the absolute best path forward, starts with just talking to your doctor. Sharing your story, what it feels like, when it started, what you're going through, that's the foundation for everything that comes next. And that conversation naturally leads us to the first steps toward feeling better. For coccydynia, the go-to strategies, the gold standard, are actually non-surgical. The journey almost always starts with these simple but really effective things you can start doing right away. And it kind of builds on itself. So step 1 is all about protection, using one of those specialized donut or wedge cushions to literally take the pressure off. Then step 2 is about gentle pain relief, things like anti-inflammatories or a nice warm bath. And step 3, very often, is physical therapy, which can involve targeted massage and gentle movements to ease the tension in that area. But what if you do all that, and the pain is still there? Well, that's when we can start thinking about a more targeted solution. And this isn't something to be scared of at all. It's just a very precise way to get right to the source of those pain signals. Okay, a ganglion impar block. It can sound pretty intimidating, so let's be super clear about what this is. It's a targeted injection, usually a local anesthetic, that helps calm down an overactive bundle of nerves. Remember that stuck alarm bell we talked about? This is like finding the off switch. And what it is not major spinal surgery. It's a minimally invasive procedure, plain and simple. The target here is something called the ganglion impar. It's this small little cluster of nerves right in front of where your tailbone meets your sacrum. Think of it like a central communication hub for all the feeling in that area. So, by targeting that hub, we can interrupt the pain signals right where they start. So, the big question, of course, is, does it work? What can you actually expect? Let's talk about the outcomes, because this is where the path forward gets really clear and really hopeful. This number, it's pretty powerful. The research shows that for many patients, a successful ganglion impar block can lead to a 75 to 100% reduction in pain. I mean, that's just a remarkable, life-changing level of relief. And that relief can really stick around. The evidence shows that for many people, the benefits can last for over a year. And here's the key takeaway. The best, most lasting success happens when this procedure is combined with ongoing physical therapy. It's about addressing the root cause, too. So I really want to leave you with this. Your pain is real. Your experience is completely valid. And most importantly, there is a clear path to relief. It always starts with that first conversation, with finding someone who will truly listen to your story. And as we close, just think about this for a second. What would you get back? What could you do again?
if sitting wasn't something you feared, but was just a moment of rest? Hold on to that image, because that possibility is absolutely within reach.